like the man of honor.
I can't believe he came.
You will not even begin to understand right now the value of this class for you.
I got my pen and take notes.
That's right. That's right.
That's why she acted like that.
Kelly, the night we talked about detoxification, you said that if you went through one of those cleansing programs, that you would feel really kind of rough after it.
Usually during. And it really is so variable. Some people go through it and they feel the best. Like my husband did one last week. He said, I felt better than I have felt in a long time during. So it's kind of hard to predict who's going to have trouble. I mean, obviously if you're ill, you're going to have more trouble than if you're well. But a typical well person, it's sometimes difficult to tell what your reaction will be because it depends on your toxic load and what you're pulling out and how your body's going to respond to it as to how you'll respond, as how you'll feel day to day. But I always say if you're going to do a detox, prepare a couple of weeks ahead, start improving your diet, drinking more fluid to kind of prep your body, and then don't plan a whole lot of activities the week that you're planning to do the detox. Let your body rest. That's important to get rest during the detox, and your response will be a lot better. And then if you have extra energy and you want to do more, you can do more, but don't overburden yourself with activity that week.
So are most of the programs a week?
They are from a week to 28 days, depending on 28 days. So if you've got someone with fibromyalgia or someone that's really, really toxic, you would do a 28-day, but it would be a much slower process. So they would start off, with a slower transition into their detox program versus the 7-day is just a harder, faster way to do a detox. So a lot of, depends on what their score is. If I've got someone with a score over 100, then I would do a 28-day. I would never put them through a 7 or a 10-day because they're just not going to handle that well. Yeah. All of my hormone patients, I have them do a detox every 3 months to help kind of keep their levels more in balance. And that works so well. It prevents us from having to chase dosage up and down. And it's really a good way of maintaining the lifestyle. Hormones balance is a lifestyle. And that's one of the things I want y'all to hear. It's not just about taking a pill or using a cream. If you're not willing to do what you need to do nutritionally to go along with it, you're putting yourself more at risk. And so detoxing is a big part of the hormone program that we use for sure. And it took me a couple of years in practice to realize how important that was for patients. But once they do it, they feel so much better that they're willing to do it and continue to do it. So, well, it's 6 o'clock, so we're going to get started with our topic. So our topic tonight is hormone balance as a lifestyle. And again, we go back to our fundamentals here with Empower You, our beliefs and values. What are your beliefs and values? And we'll talk about some of the confusion related to hormone replacement therapy. Because women, since the World Women's Health Initiative was published, have been so confused about their decision to use hormones or not to use hormones. So we'll talk about that a lot tonight. And then achieving your goal. So what is your goal? My goal for you would be hormone balance. Learning sustainable living, having a program that you can maintain long term. Using a hormone system that works for you financially and that's something that you can maintain long term. After Women's Health Initiative, we got into our heads as providers that we would use hormones for a very short period of time. And honestly, when women ask me today, how long should I stay on these hormones? And I say, well, how long do you want to feel good? You get to pick. If we have major risk factors, we may shorten the duration of time that they're on the hormones. But our goal is to use the least effective dose that keeps them stable over time, and that dosage will change as they age, and keeping them safe with how they use their hormones. Activities for detoxification is a huge part of our hormone program. Nutrition is information. Nutrition is huge as well as the hormones. Clarity in mind, body, and spirit, I think that's what we're all after, and energy and vitality. That's the biggest thing that I think women take away, or even men take away from hormone replacement therapy, is having the energy, not just physical energy, but mental energy. When our hormones are blunted, we tend to be flat. We're not as mentally sharp. We file things in the wrong place and say the wrong words.
Wrong name.
Yeah, wrong name, wrong number, wrong place. So what are hormones? Okay, when we say the word hormone, what comes to mind? Just throw out some words. What comes to mind when you say hormone? Estrogen? Most people think of estrogen, okay? So our minds go to female hormones when we think about hormones, when actually hormones are just a substance that's created in the body and it goes to another site to have an action. So your female hormones are created in the ovaries and the adrenal glands, and then they go to other sites, and we'll talk about those sites where they have activity. Bones is one place that they go and they're active. But they have to go somewhere else to exhibit their effects. And the only tissue that can respond to a hormone are tissues that have receptors. So it's produced in one part of the body, it goes to another part of the body that has a receptor to receive, and when that receptor receives that hormone, that whole cell changes. It becomes a whole different look. I mean, you can see this on 3D. They've got 3D videos on YouTube about hormone impact, and it's amazing. So when you think about this, you think about not only the hormones you make, but the hormones you take in synthetic form, bioidentical hormones, but then also the hormones you're exposed to in your foods. Those hormones have an effect. They're what we call endocrine disruptors. They disrupt the communication system. So have you ever been around a family or have a family that their communication is really poor? And there's a lot of chaos all the time because their communication is just so poor. Well, think about that inside your body. When your hormones are out of balance, the communication is not good. And so, sometimes the quality of our decisions are not good because we're hormonally imbalanced. So why is hormone balance difficult in the United States? Obesity is a problem. We're going to talk about that. Toxicity is a major problem. And then stress. So we're going to look at some obesity trends because I really, really feel like this is driving the train for us in America. We started tracking obesity trends back in the 90s. Mississippi was not even, actually they started tracking in the 80s. Mississippi did not make it to the map until 90, and that's why I didn't put any prior to 1990. But when we showed up on the map for obesity trends, we were leading the nation at 10 to 14%. And I want you to watch the progression since then, okay? And the colors are down below. The dark blue right now is Mississippi. The very next year in 91, we went to 15 to 19%, okay? And then in 1997, we're at 20%. Okay, well, first again, 2001, 25%, over 25%. Over 30% in 2005. Why is that? We're overfed and we're undernourished. Okay? When your body has to process a chemical, it needs minerals. When it has to process sugar, it needs minerals. You'll get mineral depleted just from eating sugar, even if the sugar's not contaminated. And that's why as females, we really need to limit our sugar intake to about 15 grams a day for cancer prevention. And this is why, because we get mineral depletion. Think about your bones. Every time you eat a cookie, you're depleting your bones of calcium and magnesium. Okay? So we're overfed and we're undernourished. We're overscheduled. And we're sleep deprived. If we could fix those things, we wouldn't have that many health issues. Okay? So hormone decline and disease. What we know that is as hormones decline, our physiology changes. There's pictures on the internet that show men and women that have been married for a long period of time. And you look at them when they first got married, and the female looks very female, the male looks very male. And as they age, it's kind of scary. They start looking alike. The male becomes estrogen dominant, right? He loses his testosterone, it's replaced with estrogen. And the female becomes testosterone dominant. Okay? And it's crazy to look at those pictures, but it's true. So as we age, we have a disturbance in the anabolic and catabolic rate. So we're losing bone and we're losing muscle faster than we're able to build it because of hormone balance. We have more inflammation. Okay, when you get up from that chair, you notice that you're getting up from a chair. Accelerated loss in bones, and decreased cognitive function. This is a thing you want to understand about osteoporosis. The muscle on your bone, the tension of the muscle on your bone, is what preserves the minerals inside the bone. The minerals inside the bone are what preserve your brain. So anytime we have osteoporosis, we have a major increased risk for dementia and Alzheimer's.
Say all that.
And you need to really take that seriously. Okay, so the tension of the muscle on the bone. That's why weight bearing is so important. Walking is great. It's going to get your lower body, but you really need the upper body strength. And if you're thin and you're female and you're white and you're over age 30, you need to be doing weights or yoga or some type of resistance. So the tension of the muscle on the bone preserves the minerals in the bone. And the minerals in the bone preserves brain function. Okay? So it's a cascade event that happens when we see hormone decline and osteoporosis. So why is there a problem with hormone balance? Because hormones should work in a symphony. They should all work together, each one doing its own part. And then when they come together, it's a beautiful thing. But what happens as we age is hormones decline at various rates. So we become imbalanced as we age. We'll see this age-related decline, 25, 35, 50, 65, and 70. What we notice first is progesterone is the first hormone that starts to decline. And we notice that progesterone starts to decline late 30s. And this is what causes PMS. So you ever wonder why in your 30s you started getting a little grumpy around that time? And then we notice next, melatonin declines around age 40 pretty sharply, and that's sleep. So we stop sleeping as well. Okay? Melatonin is produced in the brain, and its job is to help you sleep and wake up at the appropriate times. We're spending so much time inside that our brain doesn't know when to make melatonin. So we see people now where their melatonin is really high in the morning time. They can't get out of bed. They're so sleepy in the morning because their sleep-wake cycle is disturbed because they're not getting outside. Sun exposure to the retina is what stimulates the brain to make melatonin. So if you're sitting inside on a computer all day and you're not getting outside to exercise, then you're setting your body up for declined or abnormal melatonin production. Okay? And then estrogen starts to decline in the late 30s, early 40s, and then DHEA, progesterone, and testosterone kind of have a linear decline there. So we'll talk about these hormones individually, but I wanted you to see why there's imbalance. So when you start losing a hormone in a different rate than you're losing another hormone, if they all declined at the same time, gradually, then we'd be balanced, we'd just be lower. But we're so out of balance. So the WHO, World Health Organization, made it a priority to start looking at hormone balance in the way of functional capacity. Because we're living longer, but we're not living healthier. And so the cost of that is astronomical. When you think about a hip fracture or dementia or Alzheimer's that puts you in assisted care for 10 or 20 years, that's costly. So they're trying to figure out now what can we do to expand function, not just life expectancy. And hormones are a big part of that. So we used to think hormones are just a part of reproduction. After you've had your children, why do I need hormones anymore, right? But what we know is it helps with muscle tone and bone, decreases inflammation, helps protect the brain, big time helps protect the brain, and helps preserve function. So I love Maxine cartoons. She says the older you get, the tougher it is to lose weight because by then your body and your fat are really good friends. But we need to be doing our yoga. We need to be doing our stretching, and we need to have our balance. We talked a little bit before class, we were chatting, and one of the things to help prevent fracture risk as we age is maintaining balance. So really work on yourself with balance at an early age so that it doesn't become a problem. Once it's a problem, it's a problem. And so you don't want to wait until you have poor balance to start addressing balance issues. So lifestyle medicine, why is this so important? You know, back in the day, our grandmothers or our mothers taught us how to live, right? And then moms went to work and stopped cooking and stopped, tending to the family the way that they used to tend to the family. And we've lost the art of self-care. We don't know how to take care of ourselves. All we know is how to overwork, overschedule, overfeed, undernourish, and become sleep deprived. And that's what we've been taught by our family. And so getting into lifestyle medicine, having a provider that understands that lifestyle is a big part, because traditional medicine are trained to fix problems, to address disease, not prevent disease, and not help you heal yourself from the inside out. And so finding providers in your area that do promote lifestyle is important. And I think it's our only salvation as a nation in order to turn the healthcare crisis around is really taking personal responsibility. It's your responsibility to take care of yourself. You get the information of what condition you have or what condition your parents had to prevent, and then it's up to you to figure out what works for you and what's going to be sustainable for you. And this just gives us statistics as if we continue the way that we are, Medicare will be bankrupt by 2017. That's not too far away. So what is functional medicine? I wanted to talk a little bit about my practice and what we do. I was traditionally trained as a nurse practitioner and then did some extensive training in functional medicine through University of South Florida. And it is it's through their medical school, and it's very much research-based. And that's important because there's a lot out there. When you do an internet search, you'll find all kind of cures to your ails. And you want to make sure that what you're doing is sound from a research standpoint. It's research-based. It's patient-centered. It takes into account the individuality of each patient, because we're not a one-size-fits-all. Everyone's a little bit different, and that has to be taken into account when you're working with lifestyle. We look at health as positive vitality, not just absence of disease. And when you think about wellness and illness, there's a big gap there. You have to lose 70% of organ function to have a symptom. So if you wait until you have a symptom, then you really have a problem. And so looking at yourself, not just in absence of disease, but positive vitality. Do you wake up in the morning full of energy, ready to go? Or are you kind of, just getting through the day? So looking at those things, we're just programmed that that's just the way we're supposed to feel when we get older. And that's not the case. So hormones and inflammation. As we age, our bodies get more inflamed. Have you noticed that? Either friends that you have, it's just easier to become inflamed, and it's harder to get that inflammation turned around. So what do we do when we become inflamed? Stop exercising.
Take ibuprofen.
Take anti-inflammatories. Yeah, so those things create their own set of problems. So being able to figure out why you're inflamed and correcting the root of the problem is key. Diseases of inflammation are heart disease, Alzheimer's, diabetes, cancer, and hypertension. 90% of chronic diseases are because of inflammation. So you're going to see a lot about inflammation in the future in the press. Alzheimer's is now being classified as type 3 diabetes. It's insulin resistance of the brain. And so there's going to be a lot more information coming about in the way of Alzheimer's prevention and treatment. So causes of inflammation, we've touched on these in previous classes. Sugar, trans fats or saturated fats, low omega-3s, which are your fish oils, allergens, we talked about food and environmental allergies, we talked about toxins, we talked about obesity. Infection we didn't talk so much about, but this is a big one. And I tell patients, don't skimp on your dental exams, because dental disease or oral disease is really one of the biggest culprits of inflammation in the body, and it's preventable. So make sure you're getting your dental exams on the schedule. Lack of exercise creates inflammation. You are built to move, and you need to be moving every day with exercise. Stress, and then problems with gut dysbiosis.
What is that last?
The last one, gut dysbiosis, is having bacteria or yeast or parasites in the intestines creating inflammation. And that's a real big one too. We treat a lot of that. So hormones. Dr. Spiroff, he's kind of the guru of hormone endocrinology when it comes to female hormones, and he says it's a balance of all these hormones coming together. It's not that one hormone would typically get put on postmenopausal women. What do they get put on? Just estrogen. Well, it's really a balance of all those hormones. And I think the reason some of our studies have been skewed is because of the way that women were treated. They've typically got one hormone trying to do all the work, and it creates more of an imbalance. So we'll talk a little bit more about that. So estrogen, most people don't know that 50% of the estrogen is produced by the ovaries, and the other 50% is produced by the adrenal glands. We think about ovaries as being the only place that we're making estrogen. Fat tissue also makes estrogen. So as we gain more fat, we produce more estrogen. So just because you're postmenopausal does not mean you're estrogen deficient. Even if you have been menopausal for a long time, that fat tissue has the capacity to make estrogens. And then estrogen receptors are found in the brain, the breast, the bone, blood vessels, and reproductive organs. So when you become hormonally imbalanced, we get a lot of brain symptoms, okay, memory issues. We get breast disease, and we get blood vessel disease. We get problems with cholesterol and plaquing. So we'll talk about estrogens. There's more than 3 types of estrogen, but these are the primarily 3 estrogens that we see. We say the good, the bad, and the ugly. Estriol, we call the good estrogen because it behaves itself. It stays what it is. It's only going to be estriol. It's not going to change into anything else. Estradiol, we call the bad estrogen because it can either be estradiol or it can convert to estrone. So we never know which pathway estradiol is going to take. And we call estrone the ugly because it can increase your risk for breast cancer. And so when we give hormone replacement therapy, I always like to look at all 3 and see how a patient is metabolizing their estrogen so that we know how to dose them. And then progesterone is a natural balancer of estrogen. So we oftentimes will use estrogen and progesterone together. If you have low progesterone over time, we talked about PMS symptoms, also fibroids, endometriosis, and endometrial cancer can develop if you have low progesterone. It's produced by the ovaries, the brain, and the adrenal gland. Okay? And the receptors are found in the brain, the breast, blood vessels, bone, and reproductive organs. Same place that you have estrogen receptors, you have progesterone receptors. And so we were trained in my traditional practice to, if the woman didn't have a uterus, she didn't need progesterone. So we overlooked the brain, we overlooked the bone. A lot of things we overlooked by not using progesterone in these women.
I have a question for you.
Yeah.
So if you have a partial hysterectomy, is it possible you might need progesterone or?
Absolutely, yeah. And it's harder to know. With having a partial hysterectomy, you don't know when menopause starts from a hormone standpoint unless you're really symptomatic. And so, yeah, you may need both. Testosterone. Women only produce 10% of the amount of testosterone that men produce, but testosterone is still very important for females. Estrogen can convert to testosterone in fat tissue. So as we age, testosterone declines to a certain point, and then it starts leveling out because we're producing more of that in our fat tissue. And that's why we tend to get a little bit more hair growth. Our voice gets a little bit deeper because in relation to your estrogen, your testosterone's higher at that point. And that's when we look more like our male partner. Very important for bone health. Very, very important for bone health that we maintain good testosterone through our 20s, 30s, and 40s.
We can start looking like Merv.
I know. Cortisol we're going to talk about a little bit. I always look at cortisol whenever we check female hormones because there's a huge interplay between cortisol and your female hormones. Cortisol is your stress hormone. It's produced by the adrenal glands, and it's a good indicator of how inflamed your body is and how stressed your body is. So I always like to look at this. When you have elevated cortisol, which is a sign of stress, you're going to elevate your blood sugar over time, and that can lead to diabetes. You also will become, it's a sign of inflammation. So cortisol is the only hormone that will increase with age. All of our other hormones decline with age, and cortisol increases. So that's when we see this mid-abdominal weight gain happen that's just won't go anywhere because of cortisol. It's right there. If you have high levels of cortisol, it will decline your body's ability to make your thyroid hormone. So it further slows your metabolism by the interplay with your thyroid. So when we look at hormones, it's a symphony. You need to look at what they're all doing to know how to address it and what your body needs.
So you can test for that?
Yeah, you can test for cortisol, and typically with someone looking at hormone imbalance, I'll test all female hormones, cortisol, and thyroid to see how that symphony is working and know how to advise. I wanted to show you a picture of the adrenal glands. The adrenal glands are little bitty almond-shaped organs that sit right above your kidneys, and they're powerful. They are super, super powerful. They produce not only cortisol, but DHEA, pregnenolone, and epinephrine and norepinephrine. So that's your fight or flight. That's your response to stress. And, you know, the way God made us is we get presented with a stressor, our stress hormones raise, and the stressor goes away, and our stress hormones go back down. But we don't live that way. We live with Fox News on, CNN on, road rage.
And you watch all these wild movies and you go through that stress.
Absolutely you do, yes. And so these little adrenal glands get a workout, we burn them out, and they're not able to support you hormonally. Remember, a lot of your hormones are produced by the adrenal glands. So if you go through menopause at a time when your adrenal glands are healthy, that's the female that really rocks through, and she really doesn't have any symptoms. She sleeps well. She's the friend you don't like because she doesn't complain about anything because her adrenal glands are healthy and she's taking really good care of herself. If your adrenal glands are not healthy when you go through menopause or when you have a hysterectomy, then that's the person that really, really struggles. And they don't understand because they're usually been given hormones and they're not responding to those hormones because the adrenal glands are so weak. So the Women's Health Initiative, I said we would talk about this. This study was supposed to prove that hormones were safe for women. But what they did was they tested asymptomatic elderly women on synthetic hormones. So this study did nothing to help out bioidentical hormones, okay? So what they found, they stopped the study halfway through because what they found was it increased risk for heart disease and clotting and cancers. And they said, well, we can't go any further with the study. So this created a lot of confusion with women, and this still creates a lot of confusion with women because this is like the landmark study. We don't have a big pharmaceutical push now in America to test hormones. So there's not a whole lot of research going on in the way of hormone replacement therapy, and that's why it tends to still be an issue for us. I was in a traditional practice when this happened, and I remember getting the phone calls from women just scared to death to take their hormone, and, you know, what could we do but take them off? And then they were miserable because they got taken off hormones abruptly. And so it was really a pickle for everyone, the provider as well as the patient. And what they concluded with the study is that hormones had no benefit in asymptomatic postmenopausal women. And it changed our approach forever. Until I started doing my own research about hormones and what they do in bioidenticals, I wasn't using that much hormone in my practice. So like I said, there's just a big amount of confusion produced by that one study, and I think it was very poorly done and very poorly presented to the public in the way of research. So I did want to mention side effects of taking estrogen orally. When I use estrogen, I always use it topically in a cream or in a troche in the mouth, the lozenge that dissolves. Because when you take estrogen orally, it does increase your risk for clotting, stroke, heart attack, elevated blood pressure. It does increase C-reactive protein, which is inflammation. It increases gallstones, it increases weight gain. This is a really good book, What You Must Know About Women's Hormones by Dr. Pamela Smith. Well done. And it's an older book, and so I had found this book, guys. I heard Dr. Ron Braun speak in Vegas in February, and this book just came out in April. And I hate I didn't buy 100 copies because I went to try to buy more copies last week. On Amazon, this book cost over $5,000.
What?
I think I paid $12 for it. It doesn't have a price on it. I can't remember.
How much?
Over $5,000. Google it. I was just like, there's got to be a mistake. I called them. I was like, what's going on with this? Apparently they didn't publish that many. And so whoever has copies is trying to, make some money, I guess. But this is a very well done book, and I suspect they'll have more copies out soon. But it's True Balance with Bioidentical Hormones by Dr. Ron Braun. And it talks a lot about the Women's Health Initiative. It talks a lot about hormone balance. It's just very, very well balanced, well done.
True balance, what now?
True balance with bioidentical hormones. So if you can find a copy, I would suggest you get a copy. So again, I use estrogen if I'm going to use estrogen in a topical form because of the increased risk. I will use progesterone. I also use testosterone topically. I don't use testosterone by mouth for the same reasons. Progesterone's okay to use by mouth. It helps with sleep. So we use the progesterone by mouth and the estrogen and testosterone in a cream form. So we talked a little bit about detoxification last week. And one of the steps in detoxification is something called methylation. And when you use hormones, your body, in order to out-process the hormones, has to methylate the hormone to get it out of your body. And methylation is a big word for just using a methyl donor. It's a chemical equation where you use a methyl donor to attach to the hormone or substance to get it out of the body. There are some people that don't methylate very well, so they don't clear hormones very well. And that's the patient that's increased risk for problems with hormones. And so there's some things you can do to enhance methylation. So this enhances your body's ability to detoxify from hormones you're either taking or eating or inhaling or wherever you're getting your hormones. But these are just nutrients that help with that process. So I always like to show that. When you take hormones, your body has to change those in the liver and then out-process them. And you want to process your estrogens to this 2-methoxyestradiol to be safe. That's the way you methylate to get it out. And some people, like I said, don't do that very well. Each time your estrogen goes through conversion, it can happen up to 3 times with each dose. You have a chance to make something called a quinone, and a quinone is cancer causing. So that's why it's important to have that balance and to know how you methylate your hormones in order to reduce your risk. And that's why I think the studies are inaccurate, because they're not looking at any of that. They're just looking at point A and point B. And when you group a lump of patients together, you're going to have the good, the bad, the ugly all in there.
Well,
And
is there a test that will tell you
absolutely,
how
yeah. So one of the things,
patient methylates?
absolutely. So one of the things that we do, the first step I think in hormone balance is figuring out where you are, replacing what you need, and then assessing how you methylate. And that's done through a urine test, through Genova Lab. There's a urine test that you can look at the pathways and how you methylate, and then decide how to treat. And then, like I said, along the way, I always encourage my patients on hormone replacement therapy to do detoxification every 3 to 6 months to help that process. Even if we don't know how they methylate, we're going to protect ahead of time and then figure out, do they have a methylation issue. And so that's nutrients needed for this 2-methoxy is B6, B12, folic acid, and magnesium.
Why do people have mood swings?
Lots of reasons can cause mood swings, but hormones are a big part of that. When your hormones are in balance, it's very hard to have a stable mood. It's hard to handle stress the way that you want to handle stress if your hormones aren't balanced. So bioidentical hormones, what does this term mean? Bioidentical hormones are synthetic, okay? They're man-made, but they're made out of yam or soy. And you need to ask your pharmacist, how are they making it? What compounds are they using? Most pharmacies are using yam. Some are using soy. Soy is a problem because some women are allergic to soy or sensitive to soy. And I prefer not to use soy as a hormone base. So that would be a question to ask the pharmacy is what are you using? But it's compounded in a way that chemically it looks just like the hormones that your body makes. So if you look at the chemical structure of each, they're identical. And your body should respond to them the same way it would respond to the way that you produce your own hormone. So that's why they're called bioidenticals. But a lot of people think bioidenticals are not synthetic. And they are synthetic. They're just bioidentical synthetics. There are some commercially available bioidentical hormones. The patches, Clomera, Vivel, Dot, those are bioidentical, but they're soy-based. So you just have to know whether you're soy sensitive. So we use the patch some, but primarily we compound what the patient needs at a compounding pharmacy. So there's a lot of opposition to compounding pharmacies and to bioidentical hormones. Because when you compound something, as the provider, you have to know what that patient needs, You have to be able to communicate that to the pharmacy. The pharmacy has to make it, and then the patient has to use it. There's a lot of steps that have to happen in the right way for it to be safe. And there are people out there, you know, I have patients that come to me on astronomical amounts of bioidentical hormone because they went to their pharmacist and they did a symptom score only, and every time their symptoms increased, they increased the dose. They would just double the dose every time. And I get them in my practice and I'm like, oh my goodness, how long have you been doing this? So it's important that you work with a pharmacy that will test and see where you are before prescribing. Because the providers that are signing off on that prescription may not even know what you're on. They're just signing off on what the pharmacy tells them you need.
I was somewhere else when I was put on progesterone, and the pharmacy did that, made it.
Mm-hmm.
And then when I got here and tried to get a refill,
Nobody would refill it, yeah.
it's a no-go.
Because you have to, you know, this is something that is, you want to know what you're doing. You know, I respect a provider that will refuse to refill if they don't know what they're doing. You don't want them prescribing for you. So yeah, most of the time your compounding pharmacies can direct you to providers that will prescribe. So that's a question. They're a good resource to find people that are educated in bioidenticals.
Not even Robert's Apothecary would do it?
I couldn't find, and because the prescription was coming from a physician in North Dakota.
Right.
That prescribed it.
I think he could do it for you.
He probably could. So hormone replacement therapy should be individualized. It's not a one-size-fits-all. And it's not something that you start on today and your dose will be the same for the next 10 years. It may change a few times. We prefer not to bounce around that dose more than we have to, but it's not something that will go without change as you age. So I love this one. I tried yoga, meditation, and deep breathing for stress, but I still want to slap somebody. That's when you know they need some hormones.
Wow. You're a teacher?
Yeah, I bet you have to exert a lot of self-control some days.
Not good.
So when you look at what NAMS, which is North American Menopause Society, and what Endocrine Society says about bioidenticals, it's very confusing. And if you look at the history of their position statement, it's changed. Like every 2 years they change their position. One time it's good, one time it's not good. One time it's okay, one time they don't know if it's okay. I mean, it's so confusing when you look to them to help you make decisions about what you want to do with your health. But what we do know is we do need to exercise caution when prescribing. It's not a one-size-fits-all, and you need to be with a provider that knows what they're doing and knows how to assess you appropriately for hormones. The other thing you want to make sure is that your compounding pharmacy is following some type of regulation. There's a lot of pharmacies popping up out there now with all the pain creams and things on the market now that they can compound. They're just trying to make a buck. And so you want to make sure you've got a compounding pharmacy that's committed to education. PCCA is a company that assists pharmacies in acquiring product, and their product is quality. Pharmacies can order product from anywhere they want to order from. They can get it from China. You don't know what's in it. Mm-hmm. If they're a PCCA pharmacy, they're getting product from PCCA, and it's pure, and it's relatively safe if prescribed in the right manner. And there's a certification called PCAP that pharmacies can have that say that they've gone over and above to meet standard. So there's PCAP, PCAP, yeah. So you want to make sure and do your homework on what provider you're using and what pharmacy you're using so that you're staying safe with your hormone replacement.
So what's the difference in a compounding pharmacy and
a retail pharmacy?
retail?
The retail pharmacy is giving you commercially available. So it's what we've made commercially, sold in bulk.
And it's FDA monitored.
And it's FDA monitored. Compounding pharmacies are not FDA monitored for the most part and can make their own formulas. So you want to make sure their formula is appropriate for what you need and that they're getting product from a reputable source.
So they would need a PCAP approved.
PCCA, yeah.
Oh,
PCCA, yeah. Approved source of their material, yeah. So those are questions that you want to make sure you know before you just go into getting hormone therapy or really any kind of compounded drug. So the new paradigm should be to address changes that occur with the body as we age, and to buffer those changes so that you stay functionally intact for as long as possible. Some of these stuff. So we go back to the basics. Looking at waist to hip measurement can tell you a lot about estrogen. If your waist to hip measurement is high, then you're probably estrogen dominant. You have too much estrogen. Okay? If your waist to hip ratio is low, then you may not have enough, or you may be balanced. But that's one way to just visually look at a patient. If they've got a lot of mid-abdominal stuff, then they're usually estrogen dominant and sometimes testosterone dominant. And then neck circumference, looking at sleep. Melatonin's a big, big issue that we talked about. Melatonin, as a hormone, sets the stage for all of your other hormones to be produced. So if you're not sleeping and melatonin is off, then you're not going to have other hormones to balance well. So looking at neck circumference, for women it's 15.5.
Yes. If a person gets enough sleep and they're still sleepy, what's causing that?
That's a great question. A lot of times people are asleep and they're not aware that they're not getting REM sleep. So they may be thinking they're asleep, but they're not in the right sleep stage. They may be snoring at night or waking up at intervals and not be aware that they're waking up. So having a sleep study might give you that information about your energy level during the day. Medications can cause sleepiness too during the day. But what I find a lot of times, I test melatonin levels on some patients with sleep issues or with fatigue issues. And what I find is their melatonin's high during the day and it's low at night. And so that's the person that's not getting outside enough. So you may not be getting enough sunlight exposure during the day to produce melatonin at night, and melatonin may be artificially elevated during the day. So that can make you sleepy during the day.
So these kind of lights do
They're
not
horrible.
help
They do not
produce
help at
melatonin.
all. Not at all. And then remember, food is information. So you want to make sure that you're getting adequate nutrition, lots of vegetables. That's where you're getting your minerals. And the juicing is a great way to get those minerals right into the body. And then we talked about this in one of our earlier talks, the metabolic consequences of disturbed sleep. And because this is just so fundamental, look at the list. Short-term memory loss, fatigue, we talked about that. Disruption in thyroid hormone, alteration in growth hormone. Growth hormone is produced mainly at night, pulsatile. Growth hormone is what kind of sets the stage for all other hormones too. And as we age, growth hormone does go down naturally. But you want things that you can do to increase growth hormone or get good sleep and exercise. And that'll help increase growth hormone. Naturally increase growth hormone. And then exercise. We want to make sure we're getting a minimum of 20 minutes 4 times a week. Preferably 45 minutes 4 to 6 times a week. But exercise helps your body in so many ways. We were designed to move. We were not designed to sit in front of a computer all day. And so we need to make sure that we're allowing our bodies to move. And then remember the interaction between genes and environment. When we think about risk and hormones, genetically we maybe have family history of breast cancer and things like that, but it's really the environment that we're putting ourselves in that dictates who's going to develop cancer as a tumor. Most Americans have cancer 8 times in their life, and they may not ever develop a tumor because their immune system takes care of it. Our immune system's developed to be on surveillance for cancer cells and to destroy. And when we have a poor environment for our cells, then that gives the cells an opportunity, the cancer cells, to proliferate. So always remember, it's environmental. It's what environment you're putting your cells in on a day-to-day basis. And this is our clinic information. If any of y'all don't have that, you can write that down. So any questions? I hope this stirred up your brains to thinking about your hormone balance. I have passed out this hormone inventory. So this is just a real quick way of seeing where you are.
Could you go back to the statement about, again, you just mentioned it, sun exposure, at least 15 minutes to produce melatonin per day,
Yes.
is that correct?
Yes. That would be the recommendation for melatonin production.
Do you have to be in the sun, or can you like be sitting in a shaded area
Yeah, you
looking
can be-
out into the sun?
Yeah, as long
Okay.
as the sun is out.
Okay.
You don't have to be like directly looking into the
Lay,
sun.
lay, you don't have to be laying in the sun or
No.
anything. Okay.
So I say, ways to do that, eat outside. If you have a deck or some place outside in the evening time that you can go. Or when you get up in the morning, the best thing to do is when you get up in the morning, go outside and have your coffee or quiet time outside. Because the morning time exposure really helps tell your body it's morning. Let's get that melatonin level down and increase all the other hormones. So if you're really struggling with daytime fatigue or not able to sleep at night, if you'll get that early morning exposure, and that's not even bright sunlight, it still works.
And also walking.
That's a great way to go for a walk in the morning. And then using a light during the wintertime. Some people will get those sad lights. They're pretty easy to find on the internet to help simulate being outside. And that can also help if you're not able to get outside, or you're in a situation where getting outside's not doable, then using a light can be beneficial as well.
What does that do?
Same thing that the sun does. I mean, it just helps.
Tells your brain that.
Yeah. Yeah,
to
you can put them in
reset.
there's a lot of people that put them in their office because they're just inside of the computer all day. And the computer light's the worst light that you can be exposed to from a brain standpoint.
Is that SAD light?
Yes, SAD light, yes.
Especially if you don't have a window in your office.
I know.
So do you just shine the light like on your work area?
Yeah,
That don't really is.
kind of close to your head so that it's shining directly kind of down at you. Yeah. So.
So is it fairly easy to go in and say, hey, I want a hormone test?
Before January the 1st, it was really easy. And here comes healthcare change. A lot of insurances are no longer paying for hormone testing. And so it's doable. And we're working with labs to make it more affordable. But it's not as easy as it used to be.
So if you go in and request a hormone test, they'll request all these hormones you've talked about, the estrogen and the estrol, the good, the bad, and the ugly. They test all of that in a typical, what would you call that, a hormone profile or just a hormone test?
Yeah, a hormone profile. And every provider is a little bit different about what they'll order. So it really depends. Most of the pharmacies that are doing bioidentical hormones do the whole panel, where they're looking at progesterone, testosterone, all of the estrogens, and cortisol. But if you go to, like, say, an OBGYN, they may only look at estradiol and think they've looked at your hormones. That's just a difference in training and a difference in what they're looking at. So
Seems like I've heard that there was a local pharmacy here that did a swab inside
Salivary,
the mouth. Is that the hormone?
yeah, and that can be a really valid way to look at hormones. When you look at blood levels, you're looking at what's circulating. Remember, they're
Right.
produced in one area, they go in the blood to be transferred to another area, so they're really tissue bound. They're either bound to tissue or they're bound to sex hormone binding globulin. So when you do a blood level, you could be deceptively low, but really not be low.
So
So the salivary test tells you tissue levels. I like that a little bit better. And then urine tests tell us what you're excreting. So it depends on the age of the patient and what we're looking for as to the mode. If it's a premenopausal woman, then I may look at serum because they're producing all the time. If it's postmenopausal, then I'm going to look at salivary. If I'm looking for metabolites, I'm going to look in urine. So you have to know where you're looking and what you're looking for to get an accurate reading on your hormones.
What makes a person weak when they eat, but they still get weak? They have that weak feeling.
Is it primarily after you eat? Yeah. Sometimes that's food sensitivities. Your body not responding well to food, like foods that your body may be sensitive to. So
So that can make it.
that
you
can
feel
make
weak?
that can make you feel weak. We see that a lot. We see a lot of food sensitivities.
Or what do you do?
We typically have you do an elimination diet and then add foods back one at a time and see what's bothering you.
If you wanted to get a test, do they just send the it's saliva or urine, they send it to a lab?
They do. Yeah, typically you go home with a kit, you collect it, send it off to the lab, and then the lab sends the report to your provider to interpret.
Okay.
And when you say provider, you're talking about the pharmacy.
Either the pharmacy
Or
or your
the
physician
physician.
or
What
nurse practitioner.
pharmacy does it?
I would think Robert's Apothecary, and I think Robert's Apothecary, it's over on Fifth Street, kind of near the hospital.
I know he does the saliva thing.
Uh-huh.
Somebody in our
And
office
I-
just got the
Probably
kit.
uses ZRT. Most of the pharmacies use a lab called ZRT.
And I think Southern Drug up here on Main Street
Yeah, I think they may, yeah.
do the
They
compound.
compound, yeah.
Yes. Well, you guys have been great.
Oh, you have been great.
Great.
You really have. Let's just give her a